Thank you, Mr. Chairman. Mr. Shakespeare, before I ask a question, I just have to say I'm really impressed. We asked you to come here and talk about something really deeply personal and really emotional, and you've been very poised about it, so thank you for that. I've spent most of my life in really rural areas too. You and I were talking before the start about some of the places that we both know. And we all know, we talk about all the time in Utah how we're losing our rural kids to urban areas. They have to leave to get jobs. And the governor of Utah has made a big push to bring more jobs to rural areas, and that's wonderful. But your story is a reminder that even when us rural kids grow up and can get jobs in our small hometowns, if anything goes wrong, we still have to move to urban areas where we can get medical treatment or whatever else the problem is. So thank you for being here and talking about the challenges you're facing and what we can do to better support rural areas, because they're important to the economy. I don't even have a question for you. I just want to say thank you. Mr. Cullimore, you talked about how the state does a good job of supporting the BioLife industries and how we need more federal cooperation. Could you talk about what the state's doing well and how we could support that from our federal level?
Well, the state of Utah has identified the life sciences industry as one of its 5 target industries for development. To that point, they have taken the approach of providing funding in critical areas that encourage development of these companies. So, for instance, last legislative session, the legislature passed a life science initiative bill to provide money to develop a workforce specifically for life science needs, which can be very unique. They've also established a fund called the Utah Innovation Fund, which is intended to help bring technologies that are early stage at our universities and institutions out to an investable stage. It's really hard to get these early technologies to a point where investment community will take a look at them. And so that is a key bridge that they've helped provide. I think and they've provided research and development credits and other kinds of incentives for companies. So from a federal perspective, I think continuing to provide the kinds of tax things that Frank articulated earlier are critical to making sure that we have that. Trying to limit the kind of barriers that we face. The life science industry is probably the most regulated industry in the country, and finding ways to reduce those barriers will help bring products to market a lot faster. Medicare itself could be a great toolbox or a great sandbox for doing some of that.
Thank you. Mr. Watanabe, you talked about PBMs, and it's something that I hear about a lot. I have independent pharmacists and even larger chain pharmacies that we've all heard of. They come talk to me about how there's a middleman that's making all the money. You talked about the same thing. I know it's something all of us up here are hearing about. What would your ideal PBM solution look like?
How much time do I have? I do think that the intermediaries in the healthcare system have become a real problem and are probably one of the major drivers of growth. The concentration in the PBM sector and now increasingly with the insurance sector is also a problem. They have immense power vis-a-vis physicians, pharmacies, and the innovators. They now control access to care in many cases, right? And they're dictating to doctors what drug their patients can receive rather than the doctor making the decision for themselves what's the best choice. And at the same time, they're extracting large amounts of money from the companies who are innovating, and they're not passing that money on, those savings on to the patients as it was originally intended. I think increased transparency is a very good first step, but I think there are a number of other things that Congress can look at to reduce the power of these intermediaries, and ideally to ensure that any savings that are realized in the system are passed on ultimately to the patients who need access and who are spending an immense amount of their own money caring for themselves or for their loved ones.
Yeah, and we just heard Mr. Shakespeare testify. He'd like to have parents make more of those decisions, not have them be made by somebody who crunches numbers in an office somewhere, and I agree with him. Ms. Soares, sorry, Dr. Soares, I'm almost out of time, but quickly, what federal policies do you think are acting as barriers to Americans getting their cancer screenings and being responsible upstream for their own health? Is there anything we can do to support you there?
I thank you for the question. I think there's many things that can be done. Some of them are touched about. step therapy and step therapy and pre-authorizations. This is hugely affect how I can care for my patients. Patients might elect not to continue treatment because if I have to start with a medication that I don't think is ideal, but step therapy requires me to do, they might have a lot of side effects from that treatment, and they might decide that they don't want to have the treatment anymore because they got traumatized by the side effects. But I have tools to help the patient. It's just that these issues are limiting my ability of provide the best care that I want. And it goes also for testing and novel testing and innovations. There are these pre-authorizations that are put in place that I cannot give the treatment or do the test that I need for my patients. So that is an issue. Also, we need to continue telehealth coverage. That's the only way that I'll be able to continue to provide the care for my rural population. As you heard, at least 30% of the patients that we have in clinical trials for at Huntsman are rural. So that's my people. I need to be able to provide care for them. So we need federal support for that.
Thank you. My time's up, Mr. Chairman. I yield back.